Hello, welcome back to Informal Reading Solution. Today we shall be discussing parathyroid and of course the regulation of calcium and phosphate homeostasis. It is very important to know these drugs which are used in this in parathyroid and calcium regulation and phosphate regulation. Now, of course, we know that calcium is contained. 99% of calcium and phosphate are found within the skeletal bones. The hormones which we shall be discussing, or the agents, are the parathyroid hormone, the FGFIII, or the fibroblast growth factor 23, is responsible for phosphate metabolism, the vitamin D, and of course the Kalestoning. This is an inhibitor of the pH, the parathyroid hormone. Now, which are those conditions which we can talk about in this, which we shall be managing? One is hypoparathyroidism. Hypoparathyroidism, of course, we know rickets, those disorganized bones, curved bone, osteomalacia, softening of bones due to vitamin D deficiency, osteoporosis, low bone density. This one is common in menopausal women, and of course, Paget disease, increased bone resorption. Of course, we know when there is increased bone resorption, there are those patches which form on bone, and you can easily see them. Let us look at vitamin D. Now, vitamin D plays a key role. Vitamin D plays a key role in calcium homeostasis. Of course, we know exposure is mostly found from exposure of the of the skin to sunlight, and of course, vitamin D is activated into active form from of course vitamin D active form, calcitriol. And of course, calcitriol augments and increases absorption and retention of calcium and phosphate ions and helps to maintain their normal concentration in plasma. Which are those drugs which can be found in pharmacies? The analogs, we have doxacalciferol and egocalciferol. Also, we can have the calcitriol, this one, analog, the active form, calcipotriene, this one, and that one. The pronunciation may be poor, but in short, you know the spelling. Now, let us look at the parathyroid hormone. Of course, we know the parathyroid hormone is secreted by the parathyroid glands, which are located behind the thyroid gland. What is the effects of this hormone? In bones, it activates the osteoblast activity, increasing the bone resorption and hence increasing release of calcium into blood. It also increases reabsorption of calcium and phosphate ions from the renal tubules, the distal and collecting renal tubules. Also stimulates the conversion of inactive hydroxyvitamin D to active the calcitriol, active dehydroxyvitamin D, by of course this enzyme 1-alpha hydroxylase in the kidneys. Now, which are those drugs which may make the parathyroid effects? We have teriparatide and abloparatide. There are those calcium sensing drugs, or the mimetics, such as cinacalcet. It mimics the calcium level, enhancing activity to calcium sensing receptors expressed in various organs, and also increases the sensitivity of calcium receptors in the parathyroid cells to reduce parathyroid hormone secretion. Because if the receptors sense that there is high calcium in the blood, there is no way they will activate osteoblasts to release calcium from the bones. Now, of course, this one is used in hypoparathyroidism, mostly in adults with condition called CKD, chronic kidney disease, and may also be used in hypercalcemia conditions. Let us look at the sodium fluoride. Of course, we know sodium fluoride. It enhances osteoblast activity and increases bone volume, distributed widely in organs, tissues, but concentrated mostly in bones and teeth. Now, of course, we know that most of the toothpastes which we have, even the adverts which we see on TV, most of them contain a fluoride, because fluoride increases this, and it is used in prevention of dental caries. However, we also have radionuclide, fluoride. I may be fast in speaking just because I don't want the video to be long. However, you can always refer to it later on, or you can refer to other presentation which you have. We have the radionuclide F18 used in skeletal imaging, because we sure if you use fluoride, it will be distributed within the bone and teeth. Now let us look at the FGFIII, the fibroblast growth factor 23. Now I say this one is mostly linked to phosphorus metabolism. Now the osteocytes and osteoblasts secrete the FGFIII in response to dietary phosphorus load and to the changes in serum phosphate. Now, of course, this one, it can promote urinary excretion, of course, in case the phosphates are high, and also suppress the active, suppress the formation of active vitamin D. Because we remember we talked about that vitamin D also enhances the absorption of what? Of phosphate ions. So if we suppress vitamin D, again we shall be having little amount of or small amount of phosphates in the bloodstream. Of course, now this type of phosphate metabolism can lead to osteomalacia, weak muscles, and of course malaise. Which are those agents? We have the phosphate analogs, we have the phosphate binding agents taken with meals to reduce the amount of dietary calcium absorbed. Examples, we have calcium carbonate and calcium acetate. These one they can inhibit, they can bind to the phosphate and inhibit absorption. We also have the biphosphonates, chelate or form complexes with the variant ions such as calcium with strong affinity to bond, and of course this one, it inhibits direct reabsorption from the bonds, and it is in Paget disease. Of course, remember, if you inhibit calcium, most of these ions, they go hand in hand. The examples we have: first generation, Medronate, up to the third generation, Resdronate. I always refer to them later on, or you can refer to textbooks which you have. Let us look at the Kalestoning. Of course, this is a hormone which is synthesized within the thyroid gland. This one, it counters the effects of parathyroid hormone by inhibiting the activity of the osteoblast in bones. It's very important to know all this. Also inhibit the absorption of calcium in the kidneys that is excreted, used in also hypercalcemia and in Paget disease. Now, estrogens are very important because they prevent accelerated bone growth. Remember, in the menopausal women, we are having a problem of weak bones, and which can easily lead to fractures. This has been a short presentation about these drugs. I hope I've tried to explain them properly, but remember, this is a short presentation, just short. There is more more online or in your notes or in those apps you have. These are other presentations which we have in endocrine system pharmacology. You can always refer to them and get more information. Thank you very much. I always Wilson. Thank you for listening to me. Subscribe to Informa Training Solution. Leave a comment on how you can improve. Give us a thumbs up. Those comments can be good to help us improve on our presentation. And thank you very much.